Hey, everybody. I'm Laura Murphy. I'm faculty in social behavior and population sciences. And I'm really grateful for joining us in the room or on Zoom. And welcome to the first event of the Social Innovation Learning Lab, a set of activities taking place this spring semester to explore directions for social innovation learning community that can support our graduate students and with change-making related careers and pathways. And our speakers represent two pathways. We want to inspire students to learn more about social innovation tools like design thinking and the global social innovation ecosystem of actors like Echoing Green and Ashoka. And we want to connect and support faculty and staff interested in social innovation as social entrepreneurship, as social enterprise, as systems change, as design thinking, as tools to develop new and relevant solutions to wicked, complex societal problems. And this initiative grew out of conversations with Dean Lovista in the summer. He reached out for a Zoom call and said, I want social innovation. I said, okay, well, we'll start exploring and seeing more of what we can do. And then Molly Demis-Benedy as Office of Strategic Initiatives in the School of Public Health. And the SILL team is the Social Innovation Learning Lab team. The team is me, and then in the room we have Teresa writing. And in our Zoom space is Stephen and Justice, who are on the 24th floor, like in mission control, managing Zoom. So we have this hybrid situation. We started planning in February, so all this is coming together. We're running these two alumni panels. Today is the first, and Stephen will be hosting that. Another on Tuesday to feature alum out in the world using their graduate degrees to do interesting things and sort of alternative pathways. We'll also offer a design workshop in April, scheduled for April 23rd, a Saturday, to take feedback and ideas, and you can help us design the social innovation learning community we'd like to see. That's the thinking. And then we'll be gathering feedback and learning from these events. So at the end of this, there's a QR code to a survey. So we want you to fill it out, share some thoughts, hopefully be available for further discussion and conversation to see what you'd like to see going on. I want to recognize the support of the Taylor Center, as well as the School of Public Health for funding one of our GAs and for Buffet of Food as a partner in envisioning social innovation in the School of Public Health specifically. So this particular event features two alum who are public health scholars, educators, and researchers, and also social entrepreneurs. And they each have their own pathway. And I'm going to hand it over to Stephen at this point, Stephen Dominguez, a doctoral student in the school, and he's our host for this conversation. And then Q&A with Dr. Jain and Dr. Bilifield, who are zooming in from California and Washington State. And yeah, so I'm going to hand it over to Stephen. So this is going to run as a Zoom-led event, and then there'll be time for conversation, Q&A afterward. And if you're hungry, come up and grab one food while this is going. So handing it over to you, Stephen.
All right, thank you so much, Dr. Murphy. Hello, everyone, and welcome to our event, Linking Public Health and Social Innovation, an alumni panel. This is our first event of the spring semester for the Social Innovation Learning Lab. And as I was introduced, my name is Stephen Dominguez, and I will be the host for today's panel. We are very excited to have with us today two alumni who merge social entrepreneurship and research in public health in unique ways. Allow me to introduce Dr. Alissa Bilifield and Dr. Anoop Jain. Dr. Bilifield received her PhD in public health from Tulane University and her Master of Science in Environment and Development from the London School of Economics. She's a social entrepreneur and a co-founder of the Cookbook Project, a food literacy and cooking education nonprofit. She is also a faculty member in the School of Public Health at the University of Washington. Also, we have with us Dr. Jain. He received his MPH from Tulane University and received his Doctor of Public Health from UC Berkeley. He is now a postdoctoral researcher at the Harvard Medical School. He is the founding director of Sanitation and Health Rights in India, SHRI, which is an organization that fights to eliminate open defecation throughout India. SHRI has received numerous awards and fellowships for their work, including Echoing Green, the Global Citizen Award, Y Combinator, Malago, and the Muhammad Ali Humanitarian Award. Thank you both so much for being here. I know that I just gave a brief overview of your work, but could you please elaborate and tell us in your own words about the current work that you do? Whoever would like to start first.
Alissa, do you want to go?
I would love to go. So I moved around a bit in the last couple years, but so happy to be here and greeting folks in New Orleans and in other places. I would say that my current work as an academic is oriented around teaching and research, but my research is very much still steeped in social innovation and social entrepreneurship. So I've actually extended my focus on fair trade and farming communities, in coffee producing communities in Guatemala, to look at tea producing communities in Sri Lanka, with a follow-up study on cacao, all looking at innovative ways that producer organizations and also businesses and social entrepreneurs are looking to address some of the root causes of poverty in these communities. And I'm actually really excited to let folks know that I'm the author of a book that will be released on April 22nd. I just got an email yesterday, that's our publication date, with Routledge Press, that focuses on brewing sustainability in the coffee and tea industries.
Yeah, and thanks everyone for organizing this. It's great to be back and to have one camera looking in on the inside of Tidewater. I haven't seen Tidewater in probably close to a decade now. So I wear a couple hats. One hat I wear is, as Stephen alluded to, is I'm a postdoctoral research fellow at Harvard Medical School in the Global Health and Social Medicine department. And there I'm really getting training from my advisors on a couple things. First is to study the social determinants of maternal and child health in India using these sort of large scale population level data sets, DHS data sets. And then the other part of my training there is building out a monitoring and evaluation platform for the organization that I run, Sanitation and Health Rights in India. And so my organization, Shri, we've been, operational since my time at Tulane, and we're scaling, and we've been continuing to scale. And as it relates to social entrepreneurship, and I'm sure we'll get into this, more in depth as the conversation proceeds, but I'll just say, our view as us being a social enterprise, how do we distinguish ourselves from other companies and organizations? And the way we think about doing that is by saying, our role is to strengthen systems, the democratic systems, the government systems, and the government policies that are supposed to be delivering services. And so that's just sort of how we're thinking about it, and that's how we want to design our monitoring and evaluation platform, to be really tracking indicators of system strengthening.
No, that's really interesting. So you both are talking about how you are working currently in the academic sphere. And I'm wondering how you balance wearing those multiple hats. How does your work as an academic kind of support your work on your initiatives as well in social enterprise?
Yeah, I mean, I'm looking, I have two monitors here. On one monitor, I have Stata going, and that has nothing to do with the people that we serve on the ground. And yet the training I'm getting by doing this research project is with my advisors at Harvard is really helping me understand at a population level different indicators and determinants of maternal and child health in India, so that as an organization, we have a very good understanding of the issues that the communities we serve face, right? I mean, so in a place like rural India, it's not as though the only issue people face or the only deprivation they face is the lack of sanitation. They face a whole host of deprivations. And I think as an organization, if we think about system strengthening, our job is to really understand how do we provide integrated interventions in the long term that serve these various needs. Because as a social epidemiologist, I've been trained to believe that there is no single determinant of disease, and that there are these very complicated pathways. And so for us, it's really important to understand what the different pathways are and begin to try to address those simultaneously.
I'll jump in and provide a little bit of a kind of historical view of how the academic environment, I think specifically at Tulane at the School of Public Health, and also with is it the Taylor Center for Social Innovation now, no longer entrepreneurship, correct?
Social innovation and design thinking.
Okay, great. So I think there was a name change since I was at Tulane, because actually as of now, so I founded the Cookbook Project in 2010, and I started as a doctoral student in 2014. When I accepted an academic job in 2018, which long backstory to that, I moved onto the board of directors of the Cookbook Project. And the Cookbook Project was actually directed by an MPH student, or graduated MPH student from Tulane, Robert Palestina, who's now back at Tulane working as well, which is a really cool connection. But anyways, the Cookbook Project as an organization is actually now being absorbed into a larger national organization called Common Threads, which focuses on some of our content area, but is also more expansive. And Common Threads really has the ability to kind of expand and scale the work that the Cookbook Project had initiated and kind of developed over the 8 years that I was involved as a co-founder and in various other roles. But I will say one of my primary reasons for joining a PhD program was actually to inform the development of the Cookbook Project. And I think the organization really benefited from influence from the School of Public Health and also the Taylor Center while I was there and beyond on a number of fronts. And I would say monitoring and evaluation is a huge part of that. And I think especially learning and then integrating monitoring and evaluation techniques that were non-traditional and were more innovative. So developmental evaluation, for example, which really, not necessarily that it's intuitive, but that it's a developmental approach to evaluation that really, I think, mirrors the design thinking process. So it's more adaptive rather than kind of rote and structured, has kind of been the tradition in public health. And so that was incredibly useful. And I remember really vividly going through, I think, I'm not sure if they're still called the Fast 48, but I did one of the Fast 48 weekends when I was a graduate student. And it was super influential in terms of how I thought about, not just for the Cookbook Project, but also beyond in terms of my research in communities and the work that I was doing in communities, particularly in Guatemala at the time, how to approach questions from more of a grounded theory space. So a lot of times in academics, we kind of go in with frameworks and theories, and we try to fit what's happening to the frameworks and theories. But what I really, loved about grounded theory and how it's connected to approaches like design thinking is that it really asks academics, entrepreneurs, practitioners to be in the moment with the communities and the problems that they're approaching, and to listen and observe rather than sort of dictate and tell. And I think that that's an approach that's incredibly important to learn. And I'm so grateful that, that's really been embedded in a lot of the work that I do now, as well as an educator and also as a researcher.
Oh, thank you so much. And you alluded to, how you started your organization prior to your doctoral studies at Tulane. And I guess, could you dive a little bit deeper into how you operationalize your background and how you leverage your dissertation studies to benefit the social enterprise that you were forming?
I'll answer the second question, and then if you want to clarify the first part, I don't know how much detail you want today. We only have a little bit of time this morning. I would say that some of the material ways that we leveraged, being connected to the Tulane community, and it was interesting to be wearing two hats at once. And, Anoop, I'm sure you kind of felt the same way as you were going through the MPH program. It was really just a wonderful experience, sometimes confusing, unsure which hat to wear at certain times. But, in a lot of the courses I was involved in as a doctoral student, I would focus on issues related to the Cookbook Project so that I could improve my understanding of, quote unquote, the problem or the complexity of the problems we were addressing through our work. There were wonderful opportunities to collaborate with community-based organizations in New Orleans. At one point, we even ran an evaluation study of a newly developed curriculum that the Cookbook Project had created with K-2 classrooms in one charter management organization in New Orleans. And that was in conjunction with Louisiana Public Health Institute. So, as I was a student, I was also, getting to be a practitioner as well. And I think that was incredibly valuable and enriching. And, it allowed the organization, the Cookbook Project, to develop really solid relationships at the School of Public Health and across the community that were able to kind of be extended beyond, the time period that I was in New Orleans.
Thank you. Dr. Jain, would you like to talk about SRI and how you incorporated that into your dissertation studies, if at all?
Yeah, for sure. I mean, I think, one of the things that I care very deeply about is, and so just to take a step back, so one of my NIH advisors was Dr. Paul Farmer, and as I'm sure many of you know, he passed away very recently and very suddenly. And so, I grew up spending my 20s sort of, reading his work and understanding this concept of pragmatic solidarity and the importance of fellowship and breaking bread with the communities that we hope to serve. And so, I spent from 2010 to 2015 working in rural India, and so much of the literature on sanitation in India is around individual level behaviors. And so people do not, it's sort of like rooted in the health belief model. People don't understand the negative consequences of defecating in the open. And so if we educate them, then they'll want to build a toilet, et cetera. And what's so fascinating is that in the 5 years from 2010 to 2015, I spent those first 5 years before my DrPH working with the community, living with the community, and everybody knew the importance of a toilet. Everybody knew it, right? And it wasn't about their flawed attitudes or beliefs. It was, I don't have enough money to build a toilet. I don't own enough land to build a toilet. There's no waste management system. So when the pit fills up, where do I take the waste, right? And so these massive structural barriers to toilet ownership and use, and that directly informed my research agenda as a doctoral student. So all of my dissertation work was focused on the social determinants of latrine access in India, and now sort of what I'm looking at is more broadly the social determinants of maternal and child health, more broadly in India, not just the outcome being toilet ownership, yes, no, but anthropometric failure, anemia, mortality, maternal depression, all of these factors that we know are along the pathway somewhere, as health outcomes, really taking a step back and viewing those. And I don't think that would have happened had I not spent years, 2010 to 2019, right before the pandemic was the last time I was in India. But had I not spent that time, I wouldn't have these, my ontology and epistemology would be completely different in terms of what I choose to study and how I choose to study it, because it has been directly informed by the communities that we work with, I would say.
Oh, thank you. And to kind of circle back with clarifying the first half of my question, I think that Dr. Jain, you kind of elucidated a bit of it as well. It's like when you're talking about how we learn to do research, it seems like often you generate your research question, you've got your data sets, you kind of just evaluate and then maybe publish it, right? But it's bringing it down to people and recognizing that aspect. You're talking about building empathy. You're talking about reaching out and having it be action oriented. Can you talk a little bit more about what that looks like for you in your work as you bridge both public health and social innovation?
Yeah, I mean, so there's two ways we do it. There's the part of it that is like what I like to call with my team the sort of like soul preservation work of the organization, right? So it's like it's more ethnographic, it's like qualitative work where we spend just days and days and days talking to community members, and we publish qualitative research on that, and that's really helping us define what is the importance of, say, community sanitation in communities. What do community sanitation, like what are markers of high quality community sanitation, right? And I think qualitative research is really helpful in helping clarify some of those questions. But then we have the very real pressures from our funders, right? So I don't know if any of y'all follow Kevin Starr, who's the director of Malago on Twitter, but this morning he's been ranting and raving about the importance of RCTs, right? And so there's like, okay, well, we have, and we're part of the Malago family, and so we understand, as as we build out this monitoring and evaluation platform as a social enterprise, we have to very rigorously quantify our impact, on a specific set of outcomes, whether it's child diarrhea or linear growth or open defecation, right? And so then you have these measurement issues. Okay, how do we actually measure these? These things are very tricky to measure, as I'm sure many of you know. And so it's tough because how do we? There's, like I said, there's part of it that we do for ourselves. The soul preservation, like just talking to people. Part of it that we really love. And then there's the, okay, we have to answer to our donors, and we're a social enterprise. We have a board, we have funders, we have all these people that we have to answer to in order to keep the lights on. And so part of it is driven by our funders saying, okay, we need to know how many people are no longer defecating in the open because of your services, right? And so we have to go out and measure that. And so I think, it's finding a balance between doing both of those things, I would say.
Thank you. Dr. Bilifield, do you have any response to that?
Yeah, it's interesting. My work is very much grounded in from a public health perspective, looking at the social determinants of food choice and food access, really focused on structural issues related to health outcomes. But at the same time, my first job out of my PhD program was actually at a Center for Entrepreneurship. I was at the University of Arizona's McGuire Center for Entrepreneurship, and we were hosted in the Eller College of Management. So I went from one, kind of siloed environment to another siloed environment. And it was really fascinating because I was sort of the social impact, social innovation person based on my experience on a number of different fronts. And I really got to learn the language of both the School of Public Health as a doctoral candidate, and then also, as a career track lecturer, I got to learn the language of the business school and how the business school really framed social innovation and outcomes. And it was incredibly fascinating. And I would say, what's the same from both of these areas? And I think where there's a lot of room for better coordination and collaboration and kind of understanding of one another is that, across really all centers of study at the university, a central motivating factor is, at a very basic level, observing problems in society and then trying to understand their root causes to improve upon them. And I think that's where social innovation and approaches coming from human-centered design and design thinking can really be valuable, because I see these tools as really being able to kind of rise above the discipline level language. And, at the same time, there's reference points, right? So at the School of Public Health, we use community-centered approaches, community-based research, participatory action research. That's something I've been involved in as well. And a lot of the language and the approaches we use in these styles have parallels in, of course, in other disciplines, but I think particularly in the social innovation and design thinking space. So just an interesting reflection that I wanted to share connected to that question.
Oh, thank you so much. And guys, you both have hinted at this. What kind of resources at Tulane and in Greater New Orleans helped you in your social entrepreneurial thinking?
I'd love to jump in and say there were so many, almost too many to count. And I'm sure Anoop has a lot that he'll add as well. But the ones that really stick out, the Taylor Center offered a number of funding opportunities that really allowed me to support my research working with coffee farmers in Guatemala. So there were a couple funding opportunities related to travel and exploratory research. One study even helped me to do some formative research with the tea community I ended up working with in Sri Lanka when I went to University of Arizona. I also had some great funding from the School of Public Health as well, maternal and child health. It was either a doctoral or dissertation fellowship that was instrumental in really allowing me to do this research that was interdisciplinary and didn't really fit into, a hard category as developed, by academics. And then in the New Orleans community, I would say the biggest source of support, in addition to the community-based organizations, was definitely Propeller, which is one of the social impact accelerators in New Orleans. The Cookbook Project got into their incubator program when I was first starting my PhD program, and it completely revolutionized the way that I view the organization, and it really also informed my thinking as a student as well.
Thank you.
Yeah, I would say that it was the people. I think about, when I think about my time at Tulane, it's impossible for me to separate it from thinking about Dr. Murphy, Rick Aubrey, who was there at the time, Stephanie Barksdale, Rebecca Otten, all of these people who have just for years now been cultivating and nurturing this space at Tulane that has helped organizations such as mine get off the ground. I think I remember back, this was the spring semester of 2012 when we were applying for the Dell Social Innovation Challenge, and the lengths to which Rebecca Otten and Stephanie Barksdale went to help us set up practice pitches with outside judges, right? And that just, that was for us just so invaluable in terms of a resource. And then the next year, as we applied for Echoing Green, putting us, helping us connect with folks in the New Orleans area who had either gotten to the finals round, like Johanna Gilligan, from GODAT, Amika Riali, who was in New Orleans at the time, who was in Echoing Green. So connecting us to those people who could serve as mentors and guides as we went through the process. One of the, I'm from New Orleans, so I feel like I can say this, but I think a blessing and a curse of New Orleans is that it's a very small place. And so for those of you who are, you can take advantage of that, and not in sort of like a, slimy way, but in a way that's like, people know each other, and it's so wonderful to be able to create a network for yourself of people who are going to support you and have this network that has your back. And I think that for me was the most important thing. Like I said, it's impossible for me to separate my time at Tulane from the people who propped us up and gave us that platform.
Definitely. Thank you. And I think with that, I'd like to open up the conversation a little bit more. So if there's anybody on Zoom who either has a question or would like to speak up, feel free to do so or throw something into the chat. We'll take a couple minutes for that. And I guess as we're waiting for any questions to come through, if you could kind of talk about maybe some of your goals moving forward, your 5 to 10 year goals, professionally and for yourselves.
Alyssa, do you want to go?
It's a big question. And I think an interesting one, also coming out of the pandemic. So I'll kind of story tell a little bit and we'll see what happens. So I had this experience, right? Getting a PhD in a school of public health, working at a business school. Now I'm back at a school of public health, which is really exciting. I feel like I've come home in a lot of ways. And so I kind of see my professional mission now. I'm in a school of public health, technically in the nutritional sciences program, teaching for a food systems, nutrition, and health program. So a really interdisciplinary program. And I see my goal moving forward is to really embed the social innovation and social entrepreneurship learning that I've gained from my time as a doctoral student, and also from my experience, working as a lecturer in a business school, into our thinking around addressing the problems and challenges related to food systems, where I'm at. And so one example of how that's manifesting is this last quarter. So UW is on the quarter system. I facilitated a seminar for the entire campus that was focused on food rescue innovations. And so we brought in social innovators and entrepreneurs at each level of the food system to talk about how they're addressing this sustainable development challenge of food loss and food waste locally, nationally, and internationally. And it was incredibly inspiring. And as I'm grading sort of final assignments right now, I'm really seeing through the lens of the students how they're better understanding the role of innovation and entrepreneurship and thinking differently. I think a lot of times, depending on our disciplinary orientation, we think about how to problem solve in a certain way. But I think hearing from folks who have certain backgrounds, but have embraced social innovation and social entrepreneurship, there's a certain, transdisciplinary focus that they bring to how they address problems. And so I think having students learn from that perspective is going to kind of seed this new generation of thinkers in schools of public health and also across other universities. So it's kind of a big educational goal, but I feel like I'm already starting to see that happen, which is really exciting. And being in Seattle, there are a lot of really cool food entrepreneurs and food systems activists. And so I'm really looking forward to, as I develop a scholarly home at the University of Washington, really building strong efforts amongst that community.
Definitely, a lot of big things. Dr. Jain?
Yeah, there's so many goals. I'll actually start with by saying this. I think I'm going through like a very interesting transition in my life right now, where from 2010 to 2019, I was, just constantly traveling. It was like 50 flights a year, 3 or 4 trips to India. And by the end of 2019, I was just physically and mentally exhausted. And so, I've spoken to so many other folks in global health who, the pandemic has been awful. And yet part of the silver lining to it was that it forced us to not travel, which was for a lot of us really needed. And I think that time has forced me to rethink how I want to engage with the work in India. So, how do I make sure that I'm staying just as committed to pushing the organization forward, pushing the research agenda forward, but balancing my life with spending time here with my family, my partner, my friend, and so how do I create this balance for myself without losing that commitment to the work? And so, part of the way I think about that in terms of it shaping my goals, right now, I just resubmitted my K-99 application and trying to get, a faculty position at a school with resources so I can have my own lab and have the creative license and space to study the social determinants of health in India through the data we collect as an organization, right? So how do I carve all of that out? And I think what I'm realizing is, it takes time. It takes time. It takes time to do good research. And my advisors at Harvard, when COVID started, there was this. I saw so many of my colleagues, junior academic colleagues, switch lanes from the work they were doing to doing COVID research, and I felt that pressure. And my advisors were like, nope, you're not allowed to do that. You stay in your lane and you keep doing what you're doing, because the issue that you're dealing with is not going away. And it was a really important lesson for me, just stay in your lane, keep your head down, keep working. And I think as much as my 20s and that early part of my 30s were about just constantly being in India, constantly being on the go, I think this phase of my life is really about, okay, that system is up and running, it's humming along, we're Zooming with them every morning, every night. Now it's about digging in deep here and setting up the academic career in tandem with the organization, so that both of those things can now run in parallel. And so I think it's for me, the goal for the next 5 to 10 years is, I would say, getting that faculty appointment at an institution where I have the creative license to use the data from the organization to advance the work that we're doing, and B, understand the needs of the communities that we're working with, and the social determinants of their health, and sort of trying to figure all that out.
Thank you for sharing that. I'd like to open the conversation further to anybody who's in the room downstairs in person. If you have any questions, feel free to speak up.
There is something in the chat.
Is there something in the chat, Stephen? That was just somebody maybe, it's fine.
Okay.
The mics are live above you, so if you have a question for either or both the panelists, I'll just put the camera on you gently from a distance. Here's your question. Been really interesting so far, and really enjoying hearing more about Anoop and Alissa's paths.
Well, as we give people a little bit more time to think. So here you are, both kind of steeped in both the research and the practice. And I'm kind of wondering, where do you guys see the winds of change going? Like, where are the big needs of social innovation going to be needed in public health coming up?
I think that it's all about system strengthening. I mean, I just cannot emphasize that enough. As an early, 10 years ago, when we were starting out, it was all about the business model. How are you going to sustain your work? How do you, this triple bottom line stuff? And I think that's fine when you're starting out and you're pitching to funders and investors or whoever. I think that's fine. But what I'll say is, as I get deeper and deeper into this work, our funders, they understand. Like, if you talk to Kevin Starr at Malago, if you talk to Regis at VTOL, if you talk to Echoing Green, these funders, they want within a finite amount of time that your organization get either you are a partner of the government or that you are enveloped by the government, right? And that the payer, and so Malago's thing is, who is your payer and doer at scale, right? And if your payer at scale is not the government or some sort of large multilateral or systems level payer, and you're just going to be relying on outside funding from the West, it's not appealing to them anymore. And so, what we've done as an organization is, we didn't know what it meant to build a community sanitation facility. We didn't know what it meant to operate one, and we didn't know what it meant to monitor and evaluate it. So we had to spend 8 or 9 years just mucking around in the dirt, figuring each one of those steps out. And now that we get it, we're really close to signing, some MOUs with the government coming up here, where it took us so many years to build 8 facilities. Last year, we signed an MOU and it's 5 facilities at once. Now we're about to sign one that's gonna be 10 facilities at once, right? And all of a sudden, we're not paying for the construction, we're not paying for the O&M. The issue in India has always been, building infrastructure is easy. The hard part is monitoring and evaluating it to make sure that it's open, not just today, but tomorrow, 6 months from now, a year from now. And so our value add as an organization is no longer in the construction. It's no longer in the O&M. That is the easy stuff. The hard part is, how do we develop a system of monitoring and evaluating to make sure that the staff, stuff, and supplies are all there, right? Over time. And so I think that as an organization, we're not changing the field that we work in. We're just changing how we think about doing the work, and thinking about it more like, okay, if the government says they're going to pay for this, great. what are the gaps in the system? Well, they don't have a system for monitoring and evaluation. So that's where we come in, and that's the part of this system that we want to strengthen.
Anoop, you touched on so many important points, and two that definitely arose from what you said that I think I'll just reiterate, but maybe with a little bit of a different framing. The first one is around, I think, the importance of cross-sector collaboration. And it's really obvious and seems easy to say, but I think from my experience working in a school of public health and running a kind of public health oriented nonprofit, we definitely confronted similar challenges. You know, as a nonprofit organization, if you're relying on outside grants, how do you become sustainable? And so I think whether it's partnering with government or whether it's partnering with business as well, which is often less considered in public health and something that's not as talked about in a school of public health, business has a really important role to play, as I found from my time working in a business school, in helping to catalyze and scale a lot of public health innovations. And I had the pleasure of teaching a whole class about it and just really saw the incredible potential for you know, not just government uptake of innovations, but business uptake of innovations and approaches. And as someone who's now in the Seattle-based area, I can definitely say, you know, with being surrounded by not necessarily the headquarters of Facebook, but certainly a large imprint of Meta, I think they're being called now. And then we've got Amazon here, you know, Starbucks. We have a lot of really large business forces that are shaping the local and global environment. And I think there's an incredible opportunity for public health, for the field of public health, and also folks who are trained in public health to embed themselves in these large organizations, whether it's in you know, the government sector, which is kind of more traditional, or in some of these larger businesses that are creating change on a massive scale, good and bad, to, you know, do the work that we've been trained to do, which Anoop kind of referred to. You know, a lot of it is in the monitoring and the evaluation using, you know, data, whether it's quantitative or qualitative, to help reform practices and create enhanced sustainability. And, you know, as someone who puts together kind of job logs for students, I see a lot of these really fascinating opportunities coming up in some of these, you know, huge companies. And again, that's not everyone's cup of tea. And some folks want to work at the grassroots level or the community level or in the nonprofit sector. And it's all important. But I think to Anoop's point, you know, being able to show that the innovations you're integrating are creating systems level change and aren't just addressing kind of surface level symptoms is really what's next in public health.
Right, it goes beyond just the social determinants into political determinants, commercial determinants. They all kind of impact our ability to work, right? So we got a question in the chat. So this is directed towards Dr. Jain. So you had mentioned during the pandemic, you were advised to kind of just stay in your lane and continue with your work. So what did that actually look like in terms of your data collection processes? And especially, how did you sustain that effort when resources were being diverted to COVID?
Yeah, that's a great question. Thank you, Molly. I think, so staying in my lane, there was a couple of different ways in which that was actuated. The first was, you know, my advisors at Harvard, part of the training that I'm receiving, and this was something that I sought out, was I didn't have much experience working with DHS data sets. So these massive nationally representative data sets. And that's a skill that you know, I think a lot of researchers don't always have. And so they were just like, look, you don't, you know, sure, your data collection has sort of stalled out in India because India is shut down right now, but you have these treasure troves of data sets from India, these large DHS data sets. And, you know, so we have, in the last year and a half, you know, since COVID started and we sort of defined a whole set of, you know, we've published six papers, you know, using 4 of them using these data sets, 2 of them using sort of other data sets. And so we've been able to stay really productive in terms of, you know, our, you know, like the publication, which, you know, which is the coin of the academic realm, right? And so we've been able to stay super productive in that way by, you know, my advisors saying, yeah, okay, fine, you're not collecting new data from India, but don't worry, you have, mountains of data here still. So, and then the other thing is, we took the shutdowns in India to take a pause as an organization. Okay, we cannot build new facilities, we can't scale right now because everything's on lockdown. And it was that year that we really sort of thought through, what does systems change work look like for us now? And when we come out of this, what do we want the monitoring and evaluation platform to be capturing, right? And we have been able to hit the ground running since things opened up in India after the devastating second wave there last spring. We have hit the ground running in terms of but now getting back there to collecting data that shows our quality, use, and cost effectiveness indicators. We are about to start a round of qualitative data collection, and we're about to start a round of this sort of large scale, what will hopefully be longitudinal household data collection as well. And so, I can't remember who told me this once, but it was something along the lines of, staying patient with yourself, but impatient with the work. And so understanding that, there are going to be times when, you got to just take a step back and reevaluate how you want to approach the issue, right? And working doesn't necessarily mean just working with whatever's available at the moment. It's trying to very strategically understand, okay, which of these threads should I pull on, and which is in the long term going to help me in my training and my development the most. And so there's so many ways in which, as junior academics, we need to be trained, and so understand what those different things are. And if one thing sort of shuts down because of a pandemic or for other reasons, understand, okay, what are the other things I should be and can be pursuing at this time?
Thank you so much. I want to be cognizant of our time, especially of our guests, as well as our audience who may have to go to classes soon. So if we could just transition more into, what pieces of advice do you have for both PhD students, doctoral students, potential faculty and staff who are also listening in, and how they can incorporate these types of entrepreneurial, social innovative thinking in their work?
It's a great question. And I think I'll give two pieces of advice, and they're kind of related to each other. But the first was advice that I got from my PhD advisor, Diego Rose, who is at the School of Public Health, still doing amazing work. And I would meet with Diego about my dissertation, and there were a lot of kind of planning meetings. And Diego always had some funny reference or metaphor to use. And this wasn't necessarily one of them, but he really just shared the core of it was that, whatever you're going to focus on, whether it's in your work or in your research, if you go down an academic pathway, you should feel really strongly about the problem that you're trying to solve, and you should feel excited and passionate about the work that you're doing. And so even if you're focused on a problem you're trying to solve, but you're not excited about the work you're doing, that's not going to be sustainable for you, whether you're a practitioner working in the government sector, or if you're an academic working on research. So I think those are two key components amongst, a list, but those are sort of two that I've always checked in on myself with, when I'm about to start a new project, or potentially switch from a business school to a school of public health or something like that. So I'll offer those two pieces of advice. And I would say, in keeping those pieces of advice in mind, sign up for that Fast 48 session. Go to that lecture or seminar like you are right now. Just really kind of follow your core compass in that way. And I think that will help you build the skills that you need to be successful.
Thank you.
Yeah, I would say a couple things as well. It is a great question. I would say, it's funny, when I was actually at Tulane, we went to there was like a cohort of us, part of Taylor, we went to the Ashoka conference in 2012. This must have been March 2012, and it was at Arizona State. And I remember meeting some, you know, it was Ashoka universities. There was like a bunch of university students there, all interested in social change and social enterprise. And I remember meeting a student from another school, and he said, he asked, so I told him what I do, and he said, okay, so what's next? I said, what? What do you mean what's next? And he said, so once you're done with this, what's the next issue you're going to solve? And I was like, okay, first of all, like sanitation in India is like, it's a generational issue, so I'm not going to solve it. And it, you know, like, and so I said, what about you? Like, and so I was like, okay, so how do you think about this work? And he's like, well, by the time I'm 30, I want to have 10 social enterprises going. And that's how he thought about scaling his impact. And I still think about that to this day, being like, that was absurd. You know, I mean, for a lot of reasons, it was absurd. And I would say the number one advice I can give is become an expert in what you're doing. And I say that for a few reasons. The first reason, and most important, is when in 2010, the first summer I was in India working, in the US, I consider myself a person of color. When I'm in India, everyone sees the way I dress, the way I talk, and they think I'm an American. And that difference in class perspective shifts what people assume about me. And what they assumed about me was that I was some foreign doctor who was coming in to provide certain services. And I wasn't. At that time, I didn't even have my MPH. I was not an expert at all. And people looked at me with a certain reverence. And I felt super guilty about that. Like, why am I the best option people have? And I took that very personally to say, if I'm going to work in these communities, I'm going to be the hardest working person ever, so that I can become an expert in this, so that I can best serve these communities, period. And the other reason I think you need to become an expert is because these issues are super nuanced. There was a time when I thought that sanitation was about behavior change, and that shifted. It was becoming an expert, not just in terms of the reading papers and like the intellectual sort of exercise of academia, but becoming an expert by spending time with the community, understanding what their needs are. And so I think becoming an expert is the single most important piece of advice I can give. And that takes time, it takes patience. It's not just, there's not one pathway to becoming an expert. There's the academic way, there's the spending time with the community way, there's the you learn to do by doing way. And so there's all these ways in which, you know, we can become experts, and it's incumbent upon any of us who are trying to serve communities to pursue each one of those pathways to becoming an expert, because if we believe in equality, then people deserve an equal quality of service. And it's up, until we become experts, we cannot deliver that same quality of service.
So thank you so much, both of you, for sharing your journeys and insights with us. I feel like I've learned a lot. I know our audience probably feels the same way. So thank you again, truly. And I want to thank our audience as well, who were able to participate in today's Social Innovation Learning Lab event, linking public health and social innovation. We'll be hosting another panel this coming Tuesday, March 22nd. I would implore you, and please consider to attend that event as well. As a strategic initiative of the School of Health and Tropical Medicine, and as a learning lab, we are extremely interested in your feedback. We would greatly appreciate if you could take 5 minutes to fill out our online feedback form. There's a QR code on the screen, and we'll send it out via email as well. Thank you again, Dr. Jain, Dr. Bilifield. Thank you so much.
Guys, bye.
Thanks for hosting.
Thanks. Enjoy the weekend. Take care, everyone.
Definitely. Well.
Bye-bye.